AI is moving so fast that something contrarian today, but curious if there's something you feel like is still not down the middle of the fairway.
Yeah, I think that the traditional way of talking about AI is to say, well, it does a good job getting you factual answers, but if you want real human empathy, you got to go see a clinician. And I just don't think that's right. For whatever its sources, most of the models are doing a pretty darn good job, maybe a better job at patients.
My guest today, Andy Slavitt, has been at the center of American healthcare for more than 2 decades. He's the man who rescued healthcare.gov. As a result, ended up running most of Medicare and Medicaid under the Obama administration, was the person in charge of much of the COVID response during the Biden administration, and now is a founding partner of Town Hall Ventures, which, full disclosure, is an investor in Jiminy Health. He's my guest today. Welcome, Andy Slavitt. Hi, everybody. Mark Jacobstein, your host of Neural Compass. I'm really excited today to be here with Andy Slavitt. Andy has one of the most interesting careers of anybody working in healthcare. He's started his life as a McKinsey consultant, but actually spent time in the Obama White House running what was all things Medicare and Medicaid, CMS. Really incredibly interesting and varied career, great perspective on everything from software and what works to policy, et cetera. In fact, I should mention from a software and what works perspective, also the man who helped rescue healthcare.gov during its early crisis days in the Obama administration. So welcome, Andy.
Mark, when you said interesting career and then you instantly started with McKinsey, I was like, oh, you're going to dig out of that one.
It's not a bad place to start as long as it's not the place you finish. Let's get right into it, actually, with, I think, some of the most interesting things happening right now in healthcare, of course, are happening with AI. And I think one of the things that's happening, as I think people are aware, is people are going to ChatGPT, they're going to Gemini, they're going to Claude as their doctor. Whether they should or not, it is what is happening. And I'm curious sort of your perspective on this as crisis or opportunity, and how you think about that, both as somebody who's been involved with sort of public health policy forever and as an investor.
I think we need to accept it as a fact that's not going to change, because people like what they get. I don't think they just like the fact that they can solve some of the mysteries in a simple way for their healthcare. I think the AI does a pretty good job at playing that empathetic role that people aren't getting from the healthcare system. You can ask ChatGPT 7 different times to assure you of something. You can't ask your doctor even oftentimes once, so let alone twice, without him or her getting annoyed with you. I think people are finding that the ability to not have to make an appointment, go out of clinic hours, get real answers to questions, and then when they do show up at the physician's office, to be more prepared, is a really good thing. And I think, unlike tech waves in the past, how many doctors really wanted an EMR or were thrilled with it?
We probably wouldn't have had to coerce them with a $40,000 or $50,000.
Right, exactly.
Yeah. If for every EMR implementation,
exactly.
If they
really wanted it. So this is the way technology should work. We should want it. It should feel like something that makes our lives easier. And I think this is a good thing. All technology comes with hazards and, need for guideposts, and it doesn't always end as good as it starts. Witness social media. But it's a really good thing.
And I'm curious how you think about this, because I think wave one of this with AI was a better version of what people were already getting with Dr. Google, which is to say the AI could answer questions for you. So, what does this rash mean? But the more sophisticated version of that, which is perhaps I'm going to upload some of my data, or I've got a picture of the thing, and please answer a question for me. But my hope, as the things have evolved in AI outside of healthcare, we've moved from sort of like, you can answer a question for me, into a more agentic future where you can do a thing for me. And I think in the context of healthcare, that can mean a lot of different things. I'm curious sort of how you see that evolving, in 2026, and maybe even what that looks like in a few years.
God, I'd love to know. It feels like
it'd be great as an investor. Yeah.
Well, yeah, as an investor, as a human, it feels like every 2 months you're surprised by the next thing it can do. And, it wasn't that long ago when we were all trying to figure it out and look, isn't this chat cool? And as you said, then the agentic age, and then the coding age, and these ages last about 45 days before, the next model version comes along. I think what, but it's it's only going to get better and better. I say that with full appreciation for what I tried to say earlier, which is, we'll get there. There are some watchouts, I'm sure, that we all have to pay attention to. But yeah, I think the ability to do have, not everybody likes this. I happen to like it, but to have the AI know you and give you a customized answer, and know your preferences, that's big difference, from where we were with Dr. Google. And I think it's only right around the corner, as you say, with Agentic, when you're able to get hook through ZocDoc and make appointments and get prescriptions refilled, and a whole bunch of other things that are just going to be simpler for people. And healthcare is so intimidating for people, because it's so complicated and so expensive. And this is neither of those things. It has the potential to be neither complicated nor expensive.
Well, nearly free, in fact. I mean, obviously the tokens cost a little bit, but in the context of healthcare spend, essentially free. And I think that will be one of the things. There's probably a Jablon's paradox here of like the amount of healthcare advice that people would seek if they didn't actually have to go to a doctor every single time, schedule an appointment, pay a copay, or worse, is probably far more than people actually receive today. And I think we're probably the use of ChatGPT for some of that advice is probably just the very beginning.
Now, is there a fancy paradox named after what you just said?
The Jablon's paradox is that as people are always concerned that as things become cheaper, the total revenue associated with the thing is going to go down. But in fact, what happens is the demand goes up. Because the cost and effort involved with using the thing goes down, the demand goes up. So this same thing we assume is going to happen in AI as say the cost of inference comes down. The amount of intelligence that the world needs is essentially unbounded. And so we will just use more and more intelligence for all things, including healthcare.
Yeah, and look, I think that's maybe true in other senses as well. I've taken my mother, who's 85. When she gets her 10 or 15 minutes with the doctor and they give her a bunch of instructions, she if she remembers them all at the time that she has some reaction to the medication, it would be a miracle. So, the fact that she doesn't have to call again, the fact that she doesn't have to go to an emergency room, the fact that she can just say, took so-and-so medication, should I be worried about this rash, etc. Getting that time versus having to try to grab that time from a nurse or a physician or a therapist or something. When people have their concerns, as they have their concerns, I think it's going to keep them, not only is it going to, would it, create revenue in the traditional fee for service sense, I think it can also reduce costs, as people, are able to self-manage in ways that just weren't possible before.
Well, and it should reduce costs in two ways. One, in the reduction in the need to go to human beings to provide the care, except when they really need the humans for the most complex and most interesting work. And also, presumably, in the sort of better health that people will have if they're actually doing a better job of taking care of themselves. And is sort of the prophylactic nature of hopefully we can start focusing on health rather than disease, which is one of the things that the U.S. healthcare system in general is very good at taking care of people who are sick, less good at encouraging behaviors that keep people healthy, for lots of different reasons, including the way that people actually get paid in the healthcare system. But maybe just to go back a little bit on sort of use of AI, and apologies if this is slightly self-promotional vis-a-vis Jiminy, but you guys wrote, I think, the most thoughtful response of any investor I've ever seen in any investment I've been involved with as to the reasons why you invested in Jiminy. But I think they're related to a core thesis that I imagine you have at Town Hall in general, not just vis-a-vis us, but sort of the way the world is headed, which is that the advent of AI changes the nature of the kind of care that we can provide. And this is, I think we've been touching on this, is that like in the mental health context, and I think this is true for other types of care as well. In a mental health context, if you're very lucky and you're very privileged, you have a therapist who you get to see once a week for an hour. That is a very lucky, very privileged person, but let's assume that is sort of the standard of care. I always talk about this as that's 167 hours a week where you're not able to see your therapist. I think you guys describe it as 10,000 minutes a week, which is even more compelling, perhaps. And that doesn't make a lot of sense for the treatment of anxiety or depression, let alone serious mental illness. And I suspect that that is true for lots of other chronic conditions, right? It probably doesn't matter for strep throat, but it almost certainly does for metabolic disease or somebody who's struggling with COPD, that like the notion of continuous care is a very important theme. And if you had infinite money in the system and you could have a doctor or a therapist or whomever following people around all the time, you could provide amazing care. We've never been able to afford that before, but maybe now we sort of can. And I'm curious, you know, actually about a few things. First of all, your take on my read of the blog post, but also what you think that looks like as we look out over the next few years and other changes we'll see in the healthcare system as a result.
So what you're talking about, Mark, which I wholeheartedly agree with, is that we designed our healthcare system basically 1960s, and what we designed was an acute care system. So back then, back in the day, I was born in the 60s. But this was sort of the time that my parents and grandparents, like you went to the doctor maybe once a year. You got sick. When you got sick, you often didn't recover. If you did, great. You had no other need for interaction with the healthcare system. So we designed an acute care system for what really is a chronic disease population. I mean, we've cured a lot of the things that used to kill people, and so what that means is life becomes an accumulation of chronic diseases over time because you just live long enough. Whether those are mental health issues or physical health issues, they're chronic conditions, things that people live with, and so the system that has all of its money poured into big giant buildings that we hope never to go to, or to go to as infrequently as possible, and that we hope to take care of us in those very rare but hopefully increasingly rare situations. That's not the healthcare system anymore. The healthcare system has to be redesigned and reimagined, and so we've lived with this discrepancy for the last call it 20, 30 years, where we've had an acute care system trying to take care of a chronic care set of needs. And, one could make the argument that because we didn't have the labor capacity, we couldn't do it really without completely rebalancing labor. Well, this gives us a chance. Because most of us, as we get older, we wake up every day and we have, one or more, high blood pressure or high cholesterol or anxiety or something like that. And we don't have to, as you say, wait for the 1 hour a week when it becomes, as you said, for those fortunate enough to have the 1 hour a week available to them.
I suppose it's a privileged position in some ways to have a society with enough surplus that we can afford to take care of chronic conditions. But I think we can. And to your point, like AI now actually makes this possible in ways that don't require us to train another million doctors. I mean, I will say when Lewis and I were first dreaming up Jiminy, we had two problems. We wanted to solve for the efficacy problem. We also wanted to solve for the access problem. And if you looked at the amount of mental health care that we needed to give in the United States, given the number of people who struggle with anxiety and depression, let alone serious mental illness, and the number of therapists we have, it wasn't like the discrepancy was 20%.
Right.
The discrepancy was like 500% or 1,000%, right? We needed 5 or 10x the number of therapists that we have in the country.
And you needed them in the location.
In the location, in rural locations, in urban locations where not on the coast, right? It's if you happen to be an affluent knowledge worker who lives in San Francisco, you've got a shot at finding a therapist. That is not true in much of the country. And one of the things we decided very early was we didn't want to solve for this sort of the small problems of let's figure out how to do a slightly better job of scheduling people or of making sure that there's a healthcare coverage for somebody, et cetera. Those things matter, but uh, this is probably not quite fair. We're sort of rearranging deck chairs on the Titanic. Like what you actually need to do is be able to provide much, 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 much more care, and you needed to be able to do it in a way that was really effective. And AI, when we noticed the LLM moment happened 3 years ago, AI was finally going to open that up for us. And I'm hopeful that this is true. We care a lot about mental behavioral health, but across, to your point, all chronic disease. And I think that's a real opportunity.
For those who don't do what I do right now for a living, there's 1,000 business plans that say AI that one might receive, as is appropriate for the moment. But a very, very small number are trying to do what Jiminy is indeed doing, which is trying to say, hey, how do we take advantage of this new technology to solve age-old problems that we've not been able to solve through traditional means? And, to my mind, at least, all problems in healthcare come down to quality, access, and cost. And so if you see an AI business plan that isn't addressing quality, access, and cost, it's probably not a good business plan, at least from our perspective.
I love that you brought that up because so maybe shifting gears a little bit from sort of the product side to when I think about quality, access, and cost, some of that is you have to have the right products, and some of that is you have to have the right structures in place for people to get paid because the incentives sit underneath all of this. And as we all know, the U.S. healthcare system struggles with incentive alignment, et cetera. And, one of the things that's unique about your position, there's a lot of people who invest in health tech, and oftentimes maybe they're experts in biotech, or they understand care delivery. They're former MDs, and they think a lot about product. And I think that's very important. For better or for worse, people also have to understand how people get paid and what today and how they might get paid in the future, and what the sort of regulatory environment looks like and what the reimbursement environment looks like. And so my understanding is that you were one of the folks who helped to put together the new CMS Access package. And I love it. I know this will get wonky, but our listeners are kind of wonky. So if you don't mind, maybe describe a little bit about what is happening with Access and maybe your hopes for the future as we think about an AI-enabled world of healthcare delivery.
There you go, insulting your listeners. I mean, what the administration is trying to do is they're trying to say, to support exactly what you and I just talked about, Mark, which is that care no longer needs to be defined by the time and place in which it's delivered. If, and this is the big if you can measure the outcomes that get delivered, it doesn't matter how they're delivered. They could be using technology. It could be using, something in your home. It could be using, a large variety of things. But, you need a framework. You need a structure to begin to do that. And what the administration did, and I give them a lot of credit, I'm not sure they got it perfectly right, but they certainly gave it a good start, is to say, if somebody uses, you can start to basically reimburse people who are getting care, providing care, using things other than being in the same place at the same time. And this is the first time that I think that's happened, and I think there will be, we may look back at it and say, oh, what a rudimentary effort that was, or we may look at it like we look at the iPhone 1, which is, it was basic, but it was
basic, but still miraculous, and still quite the paradigm shift. And
yeah. And it'll lead, who knows where it will lead. It will lead, hopefully people will pay attention, look at the data, and get, and start to see better care. And soon it could really change the way, care is paid for, so that, you don't need to have, think about it, paying for medical care where you don't need to have a doctor or a nurse present, is a really radical new way of conceiving of our healthcare system, and it can lead to a lot of really interesting places.
Well, you made this point earlier about this was all set up in the 1960s. So that is true for the way we think about sort of what care needs to be provided in acute care, acute conditions, for example, versus chronic conditions. And by the way, in that particular construction, I think of there's the chronic condition, something like a lupus or an asthma or a depression, which might stay with you for your life that you need to treat. I also just think like aging, like there is the acute condition of being alive, right? Which hopefully you have for as long as possible, and over time, of course, you are aging. And
That's right.
putting aside some of the negative connotations of longevity, and a little bit of the snake oil that's been involved with that, like that's a framework that I think needs reworking. I mean, I think, you know, uh, along similar lines, the way of thinking about reimbursement, like it just needs to, like we started by paying doctors or nurses or the healthcare system for their time because there was no other way to think about it, right? There was no other way that care was going to be delivered except for by human beings. And um, that's just not true now. And the only thing that will matter ultimately, I think, should be outcomes. That it gets complicated because measuring outcomes, of course, uh, you know, give me an incentive structure and people will work around the incentive structure. And so you want to make sure that outcomes aren't a function of like, well, I start with the healthiest patients and look, my outcomes are always fantastic. Please pay me, et cetera. I will say for us at Jiminy, one of the North Stars is the delta in essentially how well somebody's doing as measured by, again, to get wonky for a second, like the Cohen's D of their GAD-7 or PHQ-9 scores, for example, for people who are anxious or depressed. So you measure how anxious somebody is with something called a GAD-7. By the way, we can probably improve on that measure, but it's good enough. Or PHQ-9 for depression. And from the time you start care to when you sort of complete some cycle of care, how much better does that get? And there's been that's been capped at like a 0.35 Cohen's D, which means 0.35 sort of standard deviation return to happy or normal, is where we've been for 20, 30 years. And that's not nearly good enough. Anyways, to the extent that I think we can start to measure these things, I think we can do this across all disease areas, not just mental health. I think that's true for somebody with COPD. It's true for somebody with diabetes. And that seems like the right way to get paid. A lot of people who've been paid for their time, though, for a long time are going to have to get used to that. And that's hard. So, change is hard. Um, so I am relatedly, you are on record writing about the fact that you're predicting that this year, people will go to ChatGPT and they'll talk about being depressed and they will actually get routed to somebody who can help. And I'm curious if you're sort of seeing evidence for that happening. We're in June, so we've got 7 more months, and actually a lot will happen in the world in 7 months. I'm curious, sort of how you see this evolving.
Well, I'll tell you, I do a fair amount of speaking at hospital board meetings this year for some reason. Been invited by the boards to say, what's going on, what do we need to pay attention to, what's different, and as this conversation reflects, it's both. They're very curious about technology, and they're very curious about policy, and they're very curious about where those things meet. I think the sense I get from those conversations is that a very new front door is being created, and they all have to figure out if they're going to be relevant. I'm talking about a major $30-40 billion hospital system. If they're going to be relevant in their communities to the people that care about, they need to find a way to be connected to that work that people are doing. And I think it's in its really early stages. I mean, we are seeing some of the Agentic, people call it different things. I think ChatGPT calls it advertising, and Claude, it may be something different, but those searches leading somewhere, those dialogues leading somewhere, where people say, okay, you've now pinpointed my issue for me. You can also reflect where I can go. And so, you know, a platform like Jiminy feels like necessary if you're a clinician and you're gonna partake in that. You've got to have a way of doing that, because it's hard to just hang a shingle on ChatGPT. Um, so I think we are now, whether it happens this year, this month, next year, um, who knows? The nature of putting these predictions out there is a little bit specious, and we certainly don't see the future that clearly with things changing like this. But clearly, it feels like the future is very much going to be um, uh, I get on to the LLM of my choice, and it helps me with an answer. It takes me where I want to go, and
And where I want to go might be to a clinic. It might be, oh, that's urgent. You need to go to the hospital right now. It might be a referral to a human being, or it might be to a more specialized service. To your point, at Jiminy, if you're talking about mental health, there's plenty of others that are thinking about other types of your care, or perhaps you're already healthy. You're trying to get healthier, and it points you at the right health app or exercise app or what have you.
You know, you talked about aging. Where my wife and I are late 50s, early 60s. You know, everything my wife sees today is through the lens of bone health. That's and anybody that tries to talk to her or relate to her that isn't thinking about that is missing the mark. And there's a million things she can do to improve her bone health, from exercise to physical therapy to supplements to you know, proper eating, and her journey, like where she asks these questions. And I think there is a parallel to mental health here, but I'm using it because it's not mental health as an example. It opens up this whole world to her of all of those things: dietary supplements, food. She found a place to work out that helps her build bone health, and so forth. And in some respects, you know, I've witnessed it as a really interesting analogy to what you talked about earlier, which is moving from healthcare to health. Um, you know, that's not a vague notion. That's often something very tailor made or specific to the individual, and there's no way she would have been able to make this much progress and stay healthy and do all these good things for herself if she didn't have this very convenient front door.
Yeah, there's just, it's the time and cost and whatever else of having humans involved with all of that would never have worked. I do think, I mean, in a mental health context, we you know, at Jiminy, our focus is largely on serious mental illness, secondarily on things like garden variety anxiety and depression. And I don't mean to diminish their importance too, as somebody who struggled with them for a long time earlier in my life. But we do think ultimately in the long run, we also want to be focusing on thriving, taking somebody who doesn't struggle with their mental health, but could be happier and healthier. These things are largely on a continuum. And I think that that's true for all the different sort of aspects of your health.
Anybody who struggled with mental health, and, you know, find me someone who hasn't, and I just find you someone who's just labeling it differently, which is fine. You know, understands, I think, the importance of doing things to maintain their mental health all the time, whether that's talking to someone, exercising, eating right, getting air, sunshine, fighting loneliness, and being with friends.
A gratitude practice, mindfulness, a lot of things, by the way, which there is no way for somebody to get paid for in the U.S. healthcare system, which is fine. And then some of which historically you have gotten paid for. So like therapy, qua therapy, where you're learning CBT in conjunction with a human therapist, is something that historically you get paid for, but a gratitude practice and meditation, et cetera, historically not. At the end of the day, I think as a healthcare system, what we actually care about are the results and the outcomes.
And I think people are, for the first time, subscribing to things like meditation apps and so forth in ways where I haven't seen the data, but I think people are getting a lot out of these things. Are, you know, they're, I mean, at least these some of these companies are doing well, or so it's a we will see lots of different business models, put it that way, and I think we're going to have to be a little bit flexible and adaptive as we go along. But the good news, at least to me, is that those resources are there for people now in ways that just haven't been in the past, and they're just going to be easier and easier to use. And maybe some things people will go, oh, now I've got a thing and I'll pay for it because it's a thing I need. And maybe a lot of the stuff I don't. It's free. It's freemium, and there are business models that allow that to happen too.
A couple sort of closing questions, because unfortunately we're gonna run out of time here quickly, because I have so many other things I want to talk to you about Medicaid and some of the incredible work that you guys have done at Townhome with some businesses that have really focused on a Medicaid population. But perhaps we'll have to save some of that for another conversation. But maybe a couple parting questions. One would be something you believe about what healthcare is going to look like, and maybe mental health care specifically, that you think most of your peers don't, that you think is at least today still somewhat contrarian. And I know AI is moving so fast that something contrarian today might be mainstream 3 or 4 months from now. But curious if there's something you feel like is still not down the middle of the fairway.
Yeah, I mean, look, I think that the traditional way of talking about AI is to say, well, it does a good job getting you factual answers, but if you want real human empathy, you got to go see a clinician. And I just don't think that's right. I think for whatever its sources, most of the models are doing a pretty darn good job, maybe a better job at patients, and it's got unlimited patience.
Part of it is exactly. Some of this is not a knock on humans. Your average physician or care provider is incredibly busy. And so if they take a 10 extra minutes with you because they care about you, it means somebody else is sitting in the lobby waiting
Right.
for 10 minutes.
So could I conceive of a day when you say, hey, Andy, I've got to go see my primary care agent versus my primary care doctor, or maybe it's really neither. It's really a combination. It's a but it may look and feel from an interaction standpoint like your most primary your primary care option, mental or physical or both, is through technology. I don't think, I think we are being awfully careful to say, oh, we got to keep human in the loop and all those kinds of things. And I think I get that. But I also don't think that that's how people are behaving. I think we say that because we want to be responsible and we don't want bad things to happen, and for certain big decisions.
And we don't want organ rejection from the healthcare establishment, whether that is the people who pay us, existing physician groups, the New York Times. I think people in healthcare are especially careful for both good reasons and bad.
Yeah, for good reason. I think that's right. I think that's to be expected. But I think what's fascinating is, even as the general public would say that they're more scared of AI in general, even as general public would, and even as we would say we've got to have humans in the loop and so forth, I think the actual behavior is different. I think the actual behavior is, people may say they don't, they're scared of what AI is going to do to them from a career standpoint, or how it's going to change wars, or how it's going to change lots of things in the economy. Yet I think the numbers clearly show that, at least when it comes to healthcare, this is a big winner with lots and lots of trust, and people are and will go there first. And I think they, generally speaking, not in every case, like what they're getting.
Yeah, I actually concur. I think that the mixed feelings about AI are as deep and profound as you will find about a sort of any topic on earth. These college graduates who are booing commencement speakers who mention AI, I think what they're booing is they fear job loss, and they fear asymmetrical threats, and I get it. It is scary. Also, they probably love all the positive things that it can bring, and it is like most technologies, like all technologies, is a double-edged sword, and this one just happens to be the sharpest double-edged sword probably we will ever encounter.
It's
in our
also
lifetime.
our love-hate relationship with big tech companies.
Yes.
Because there is a haves and have-nots feeling that comes with technology, and it's getting more and more slanted as these organizations are getting more and more powerful and more valuable. And I think, whenever people feel like something's being done to them instead of for them, they feel that. Yet, people just can't quit their Amazon, right? People just can't. As much as bothers. So people are going to live with this ambiguity, I believe, or have to live with this ambiguity for some time. But I really think just if you and I just strap on our healthcare lens, there's an awful lot of powerfully good things that can happen.
Yeah, well, I'm incredibly excited about what this will mean for human health and thriving. So last question for you. I ask of all of our guests. The podcast is about mental and behavioral health, AI, and sort of neuroscience, and kind of the intersection of the three. And I'm always curious if you have recommendations for things that you are listening to, reading, watching that you think are interesting for people who are interested in things.
I find from a pure kind of mental health perspective that podcasts are a terrific thing, whether or not you're listening to something that's directly on point with the science of mental health. I know it's a bit controversial, but I like Huberman. If I've got the time to take in an episode, and things of that nature. But also, there's a lot of things that really relax people. Myself are sports podcasts.
Who's your favorite? Are you a Bill Simmons guy?
Simmons or Russillo, or
I'm an old Red Sox fan, so it's hard,
Oh, you're a Red Sox fan, so you're a Simmons guy.
Yeah, I'm a Simmons guy, but
Yeah.
But I'm not a Celtics guy. But anyways, yeah, I have a complicated relationship with Bill Simmons.
Right. Yeah. He's built a legendary platform. But look, I think for people, it doesn't have to be sports. Obviously, it is the thing you're interested in: wine, kids, school, politics, whatever it is. While we have lost the sort of general mainstream kind of thing that everybody watches and listens to, the benefit is all of us have can chase our passions, whether it's podcasts or streaming or whatever else it is.
That's actually a good way to close it, because I think about that as the double-edged sword again. It was unifying when everybody listened to Walter Cronkite every night, and had a sort of shared cultural context, and something was lost as the world fragmented. But I think you're also right that there's profound power in people being able to find the thing that they actually care about, and listen to the things that they actually want to listen to, et cetera. So, Andy, I really appreciate the time today. Super interesting. Look forward to, we need to have another conversation. Actually, we didn't have time to get into, I think, some of this stuff on Medicaid that I think would be wonderful. But thank you again for the time.
I really enjoyed it, Mark. And I'm really excited about Jiminy as well. So
Thanks.
We'll be talking soon.
Terrific. The thing I keep coming back to for this conversation is Andy's point that we built an acute care system for a chronic care world, and we've been living with that mismatch for 30 years. AI doesn't just patch that gap. It actually gives us a real shot at redesigning the whole thing. If the system was architected in the 1960s, maybe the 2020s are when we finally get to rebuild it. In this next episode, I'm sitting down with Dr. Keith Humphreys, Stanford professor, addiction expert, advisor to multiple U.S. presidents, and one of the sharpest minds on what policy can and can't do when it comes to behavioral health. If Andy gave us the systems view, Keith gives us the human one. Neural Compass is brought to you by Jiminy Health. To find out more about Jiminy Health and how our clinical-grade AI solutions are helping to shape the future of behavioral health, visit JIMINIhealth.com. And then make sure to search for Neural Compass in Apple Podcasts, Spotify, or anywhere else your podcasts are found. Make sure to click subscribe so you don't miss any future episodes, and on behalf of the team here at Jiminy, thanks for listening.